Is your back pain keeping you up at night? Do you wake up with pain in your back and nervous symptoms going down your leg? Your sleeping position matters. It can be the difference between getting zero sleep and waking up well rested with no pain at the end of the night. My name is Dr. Sean Hiller. I'm a physical therapist and a certified strength and conditioning specialist, and we are in the guest bedroom of my house, and we are talking about the best sleeping positions for sciatic low back pain. This is part of a sleeping position series that we're doing. We cover the best sleeping positions for degenerative disc disease, stenosis, for neck pain, for shoulder pain. So get on your PJs and get ready for a great night's sleep. First off, you may have a sleeping position that has been comfortable in the past and that you love sleeping in, but now it's starting to be painful. It doesn't feel as good. We're going to adjust that position to help you sleep. But you say, Sean, I'm just going to roll over. I'm going to end up in that position at some point in the night. We're also going to talk about how you can prevent yourself from ending up into a bad position. Sciatic low back pain is different than other types of low back pain like degenerative disc or stenotic low back pain. The symptoms are actually the opposite, so your sleeping position will be different. Typically for sciatic low back pain, you like to be in the position of extension. This position feels good to you, and after being in the position of extension for a while, your symptoms feel better and your pain is less. This is typical for most people with sciatic low back, so we want to use that position to help you get a great night's sleep. Before ever getting in bed, it would be helpful for you to do some extension-based exercises that will help you sleep with less pain and better movement overall. We have a video on these particular exercises for sciatica. We'll put the link in the description. You can click on those, do the exercises before you get in bed, and it will help you sleep so much better, especially when you pair it with the sleeping positions we're about to talk about. So before we address the position that we want to sleep in with sciatic low back pain, what sleeping positions are bad for sciatic low back pain? Sleeping with one leg up and to the side. This is the first position we're going to talk about. And this position is not good simply because we're in this wonky kind of rotated position. You can see here that this side is up, which means that the left side of my body is actually in a spinally flexed position, which is not what we're looking for when we're talking about sciatica. The other side of my body is actually in an extended position. Left side's in flexion with the way I have it, right side's in extension, and I have this weird spinal rotation occurring in my low back. This is not ideal at all when we're talking about trying to find the best position for sciatica. In fact, you might wake up from this in a lot more pain. Sleeping on your stomach. Your back ends up in a little bit more of an extended position, so this is good. This position isn't bad altogether, but in this position, we tend to roll out around a lot, and I never like sleeping on our stomach when our neck is at this dramatically rotated position. This isn't good overall, and it may not be helpful for your low back either. And the last bad position we're going to talk about is sleeping on your side in the fetal position. This is feeding a lot of spinal flexion. You can see my back is rounded here. That is a spinally flexed position. This is the opposite from what we want to do with sciatica. We want to put your back into an extended position. So those are the bad positions. What is the best sleeping position to help you get out of this severe sciatic low back pain? Let me show you. But before we do, guys, if this content is helping you, if you find it useful, please like our video, subscribe to our channel, and ring that notification bell so you never miss out an opportunity to enhance what moves you. It helps the channel a lot if you can do that, and we appreciate it. Now, really, let me show you. You can see here that I'm lying flat on my back, but it's not as simple as that. I have two pillows. I have one under my head. Actually, I have two pillows under my head. I have one pillow running long ways all the way from my head down to right below my mid-back. So it's kind of right below my rib cage. It's above my lumbar spine. Being in this position, it's actually putting my pelvis into an anterior pelvic tilt. It's throwing my low back, my lumbar spine into more extension. This is what we're going for with sciatic low back pain. Just being in this position, honestly, I feel a little bit of relief. This is the position with sciatica that tends to decrease pain in most patients. So it makes it an excellent sleeping position. And being in this position, when you wake up, you should feel so much better, well rested, and less pain. If you can't sleep in this position or simply don't like this position, there is another position that is an option, but it takes a little bit more setup. You can sleep on your stomach with two pillows under two different areas of your body. I've got pillow one under my chest and under my head. I can sleep on this. I've got pillow two right here underneath my quads. And you can see in this position, look at my low back. You can see that in this position, my low back is more extended. It's kind of the natural position you're going to end up in when you put two pillows here. Now, this can get a little bit more uncomfortable because it's more of an extreme version of extension. But if position one doesn't work for you, then this is a very viable position that you should try, and you're going to feel more walled in. It's hard to roll around when you have pillows set up like this. And again, just being in this position, I feel a little bit of relief as someone who has suffered from sciatic low back pain before. These positions do have problems though. It's hard to stay in this position all night. We tend to roll out of them, we move when we sleep, so we end up in a different position than what we tried to go to sleep in. So how do we fix that? We wall ourselves in. Literally, you can build a fort of pillows on each side of you, so whenever you try to roll or get out of that position, you have something preventing you from rolling, especially if you're doing it subconsciously when you're sleeping. If you're having trouble sleeping and you're rolling around, you can always defeat your fort. But the idea is you want to stay in the fort, stay walled in, so you stay in the great position that you know you're going to wake up with less pain in. Doing this fort seems oversimplified, but it works. You may be saying, great, this should help me, but do I have to sleep like this the rest of my life? No, you should only sleep like this when you're in the rehab process and trying to get back to function, out of pain, and back to your everyday life. If you are doing these sleep practices and doing the exercises that we talked about earlier on in the video, then you should be on the track to getting out of pain, and you shouldn't have to sleep like this for forever. You'll look up one day and you'll think, man, I'm sleeping great, my pain levels are gone, maybe I can go back to my favorite sleeping position and give it a shot, and it should feel fine. So use this method, do the exercises, start that process of getting out of pain. We have other videos on the best sleeping positions for the neck, for the shoulder, and that other type of back pain that we alluded to earlier. You can click on that link here to check it out, but otherwise we will see you in the next video. Thank you for joining us on the Vulcan Blog.